Hello.
Hi, welcome to AI Live, you guys.
Welcome back. We haven't seen you in a month, right?
Right?
I think it was a month. No, you weren't even here last month.
I know, I had to fly
here
out.
by myself.
So I left you to forge on your own, and you did really well. You had lots of people watching, and you
Hopefully.
did well.
Hi, guys. So, what's been going on? How was your weekend?
I had a busy weekend.
Yeah?
Yeah, I worked Friday, and then Saturday did a training down in Southern California, and then flew up to Northern California.
Ooh.
And did a dinner Sunday night, and had 2 trainings yesterday, and then flew back last night.
Ooh,
And I'm working today. I worked all day today.
Really busy weekend.
I know I did. What weekend?
I finally got to relax. I got a massage.
I know you did.
You see all the cupping that was done? I'm like black and blue all over. But it feels good. Finally, I got a 4-hour massage.
That's so
if you
not
guys
fair.
have ever got a 4-hour massage, very nice. It's somewhat relaxing, but no, he stripped me. He's really, really good massage therapist.
4 hours.
4 hours, I know, laying down.
I'd be snoring.
I was.
I would be snoring. You wake yourself up for like, oh crap, did they hear me?
That is embarrassing.
Oh, shoot. We digress. Come on, everybody can relate. Come on. I don't know, maybe out there who's had a massage that can't relate to like falling asleep and jerking.
No, but then I had to do my PowerPoint for, I'm talking for the American Family Medicine Osteopathic, and we're going to talk about PRP and exosomes and how we're using it on the skin.
Awesome.
And so, yeah. So jumping into a little bit of the regenerative side of things. So I do talk for the family medicine docs out there.
Cool.
So, yeah, fun things. Just all work, right?
We always have irons in the fire.
Yeah.
We never don't have irons in the fire.
Alrighty.
But thanks for joining us tonight. We see so many things out there that are stinking scary that we kind of want to discuss some of those tonight, and kind of get your feedback too. So we wanted to talk about some of the dangerous techniques out there. Injecting yourself, which we've seen recently. Where do you not want to inject? High risk injections, dangerous devices. We've seen some dangerous devices, dangerous products, illegal products, just all this stuff that's out there that makes your butt pucker.
Yeah.
Right?
Right. Oh, it definitely does.
Yeah.
Definitely does. But okay.
So we get to play with tonight's topic.
You get to play with tonight's topic.
We do.
Dangerous techniques and devices. This is more Lori's topic. She loves these type of things.
No, it's like I love to hate these kind of things. I love to hate them. So first we'll kind of discuss injecting yourself. We see a lot of DIYers out there, and there was a problem with someone who was doing this on YouTube.
Oh, yeah.
And
I remember that.
And remember her, and she was doing it on YouTube, and she was injecting her lips, and she was injecting herself on, and doing Hylopen, and doing these TCA peels on herself, and she had multitude of followers. And she would show people how to inject themselves, and how to do their lips, and how to do all this stuff on themselves, and people were kind of maiming themselves. They were really having some problems.
Oh, yeah.
And she would actually advertise, here, buy Bellatero Intense from Foxy Fillers. You get 20% off. And here in America, that's not even offered. It's not even FDA approved. And it's illegal to buy any dermal filler, hyaluronic acid dermal filler, from a secondary source. So if you don't buy it directly from Allergan, Merz, Galderma, if you don't buy it directly from that company, it's not legal in America. So we have to be really, really careful who we get products from. Amazon, I've had people come in the office and said, oh, I just did the Hylopen, with my friend. I said, well, don't count on me ever injecting your lips. And she said, why not? I need them fixed. I'm like, I'm not touching your lips because I don't know if you had motor oil put in your lips. Because the Hylopen is another one where or some of these products where people will buy it off of Amazon and you don't know what it is. You don't know if it's silicone, you don't know if it's bathroom caulking. If it's off of an illegal source, you don't know what it is. So a lot of these estheticians that are injecting in different states, they can't buy these products. If you think about it, estheticians can't buy these products. They have to have a medical license to buy them. So they've got to get them illegally, and it's going to be off of Alibaba or Amazon or something.
Yeah, but going back to injecting yourself, I mean, ultimately, I know a lot of us as practitioners will inject ourselves just because we are some people are in single practices and there's nobody else that will inject you, and it is hard to go and get somebody else to inject you. I think injecting yourself can be dangerous when it comes to like a little bit more of the fillers. I think toxins, whatever. I mean, at the end
It'll
of the
go
day,
away.
the worst thing is you droop your own eye and you can take pictures of it and educate your patients on what can happen, but these toxins can go away. I personally don't know how people inject themselves. I've seen even my own staff when we were growing, like stick the needles in their own lips and injecting themselves. I guess you can do it, but the whole goal is making sure that that you're not advertising it out on social media that you're injecting it in yourselves. I think it's more helping the industry grow properly, so that patients aren't going, oh well, if they can do that, I can do that myself, than buying it and trying to inject it just because they're trying to save $100-$200 instead of paying you to inject it. They're like, oh, I'll just buy the cheap product that we don't know where I'm getting it from and then inject myself. Ultimately what that's going to do is just going to harm us, because FDA is going to crack down on different things in much more severe ways that makes it more difficult for us to do what we want to do in this industry. And then you're going to get people who blame this industry for looking that way when it's actually injected incorrectly and it looks horrible. And so people are going to correlate that, oh, look, they got their lips injected and it really wasn't injected by anybody who's a professional. So it always douses and puts the fire on our industry because it makes our industry look bad. So, there's a lot of pluses and minuses. I think if you're injecting yourself just because that's who you can trust and blah, 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 by all means, go ahead and do it, but don't put it out there on social media that you're injecting yourself, because ultimately your patients will go ahead and say, well, if they can do it, I can probably do it myself, and we'll find a way. I mean, we're all human in that way, and people are always out there to try and save a buck, and so they're going to try to do it on themselves, and they're going to end up harming themselves.
And you know what, injecting your like social media, I think it's just so incredibly irresponsible. I think it's incredibly irresponsible. And I've seen everyone from nurses to doctors to, I've seen people recently do this on their social media platform, and I just am appalled. I'm like, why are you at home with bare hands with an alcohol wipe injecting your temples? What the heck are you thinking? And there was a case in Northern California where the doctor blinded herself doing it herself.
Oh, really?
So
I didn't even know about that.
Yeah, I just found out yesterday.
Oh,
so I mean, this stuff is like, just find someone you trust to do it. Yeah. And especially don't put that on social media. It's just very irresponsible. And like Dr. Clark was saying, it's just, people are going to think it's okay to do it on themselves, and they don't know. These people that are, stay-at-home moms or something, they don't know.
They don't know all the education that you went through to get to the state that you're at, that you're injecting properly, injecting safely. So, people will do stupid stuff, unfortunately. This is the day and age. Most of us, doing a tile floor. Oh, let's just go on YouTube and figure that out. I don't need to pay a contractor. Let me do it ourselves. And some of them turn out great. Some of them you're like, ooh, maybe I should have just hired the person to do it. Now I run into more issues, and now I have to actually pay more to get stuff done. So, I mean, these are the things you just have to be wary of, and to help the industry as general grow properly and grow in a safe manner and elevate our whole industry, because we already get a lot of kickbacks. I get probably 80% of my talks during my consultations with patients is, well, I don't want to look fake. I don't want to look like that person. I don't want to look like that person. I don't want to look like that person. I'm like, you know what? If it's done well, you're not going to notice that the person has filler in them. And so this is the whole industry that we're trying to break out of, in the Hollywood aspect of it, in the housewife aspect of it, is just to make sure that that we're just helping the industry grow in a better way. Okay.
So we do have a couple slides. That's our disclaimer, and we're kind of talking about all these different things tonight. We're kind of going to go into some of the high risk areas, different products that are dangerous, devices, silicone, PMMA, plasma pen, and some of the illegal products. We're kind of going to touch on them. So here's first illegal product. So this is these are the lips of a patient who was injected by an esthetician in Florida. Wow. And it was a product that she bought that's illegal in the United States. So she couldn't buy something legal, and it actually has radiesse in it. It's a hyaluronic acid mixed with calcium hydroxyapatite. I shouldn't say radiesse. Calcium hydroxyapatite. So probably the last thing you want to put in lips.
Yeah,
is
for sure.
Calcium hydroxyapatite, and this is what happened to that patient. The patients don't know.
Nope.
They don't know that they're not going to somebody who isn't licensed. They think if they're doing it, they're okay to do it.
Half of them do.
You think?
Half of them do, yeah.
You think in Miami they all know?
I think some of them do. I mean, there are enough house parties that that these are a little bit underground. They're trying to save a buck or two and stuff like that. And so, I think people do know, and the hope is that we're trying to get the word out there not to do these type of things and not to use illegal products. In and of itself, any product that isn't purchased within the U.S. from the original company is considered an illegal product. If you get products from Canada or Mexico, even though they are cheaper and they're made by Allergan or Galderma, whatever it is, you can't use them on patients here because it is illegal, honestly. So I know people are like, well, it's cheaper there, and it's the same product. Why can't we use it here in the U.S.? It's just the FDA rules that there is a batch number that they follow, and if there are adverse events, we can know what batches and everything falls in line. Yes, it is more expensive, but that comes with the more safety aspect that we have in the US with regards to following out all these things. So unfortunately we have to play within those rules. So if you are unfortunately ordering from secondary sources, be careful, because ultimately you don't even know where these products really are coming from, if they are actually US based sources or if they're from other countries. They may be Allergan products, or they may be MERS, or they may be Galderma products, but ultimately you have to realize if you have an issue with it, you're still using an illegal product, and if you happen to get into a lawsuit, there goes your license.
And just know it could be anything in those syringes. It could be anything. So
that's why Galderma changed over. I know a lot of you are like that weird Restylane lip where you have to snap it. The reason why they put that on there is because back when was it 2010, 12, probably, when they changed it, people were bold enough to take the old syringes, refill them up with hyaluronic acid, and resell it in the marketplace. So they needed to create a method that was actually a sealable, where it snaps open so that you couldn't fake that aspect of it. And so that's where a lot of these things come from, is you don't think, you go like, why is it so annoying to have to snap it? It's not the twist and pull off. It's just that was where it ended up being. They just had too many issues with people trying to refill the syringes and resell it on the marketplace, in the black market.
I wonder why they didn't do that on the Refine Define. Interesting. So I think Restylane is one of it was the first to market, so it's probably one of the most popular. So it's one that everybody loves to counterfeit. And I've actually had a nurse come to me who wanted me to inject her, and she brought her own box of Restylane. And I generally won't do that, but when she brought it and she showed it to me, I realized it was a counterfeit box. And she worked in medical aesthetics. And I said, where did you get this? And she said, I have a friend who's an ER doc who injects, on the side, so I got it from him. I'm like, it's counterfeit. I'm keeping this because I'm going to show everybody this. So it was counterfeit, but it looked really good. The box was the right color, and it had the right Restylane font. But it was, if you didn't know it, like she worked part-time in aesthetics, so she didn't pick it up. It didn't have the hologram on it. It didn't have all the writing on the back that it usually has. There were certain little things I was looking at like, this Something is not off. The right box. And so I went and got a real one. I'm like realizing there's certain printing that wasn't on it. So they do a good job of counterfeiting. Yeah. They do. So you can't really trust anybody. So those are some of the illegal products that we kind of wanted to talk. This is something that happened. This is kind of where not to inject. This is one of my patients who actually had nasolabial filler done. And this is where I found the filler, you guys. So she was complaining of tooth pain. And she kept saying it hurt after she got injected. And the nurse was saying, no, it's fine. There's no problem. I hardly put anything in there. And she went to the dentist. And the dentist checked her and said, nope, it's fine. Your teeth are fine. Everything's good. So somehow, I think she found me on Instagram. And she came to me. And I started examining her. And when I lifted up her gum, I found a bolus of hyaluronic acid in her upper gum tissue.
Wow.
So it went right through her nasolabial fold and into her upper gum tissue, and it was affecting her teeth. So
Ouch.
I just dissolved it with some hyaluronidase, and she's all better. Pain went away.
Wow.
Isn't that crazy?
That is crazy.
So that's you have to pick your injector wisely. You know, you kind of pick people. Don't pick people on maybe how long they've done it. Pick people regarding how educated they are and how often they go to conferences, they learn. They need to be continuing education. They need to be learning all the time.
Yeah.
So we see a lot of providers who.
Where not to inject any area that you are not comfortable with.
Yeah,
honestly.
right. If you're not comfortable injecting, don't inject.
If you're not comfortable with a nose anatomy and understanding the ramifications, both the positives and the negatives. You know, I know there are people that still inject labellas out there. You know, there are people who inject noses, and there are people who don't. So I think where not to inject comes down to your cojones on certain areas, of course, that have that more higher risk vascularity. But I think understanding where you are injecting, why you're injecting there, what benefits you're going to be getting. Explaining to your patients the possible complications that can happen from injecting into this area. I think you just being honest with the patient, so it's not anything that could be a surprise to them. They take the same responsibility as you as an injector for injecting the area. I think that I would say there is almost nowhere that you couldn't inject, as long as you are comfortable injecting it and you know the anatomy, you know the safety, you know the adverse possibilities, and you're comfortable with that aspect of it. I don't think that there isn't an area that you could possibly inject.
Yeah, I think we can inject any area.
Yeah.
It's just that like sometimes like I choose as a provider not to, because I don't want to put my patients under a certain risk of certain issues. So I choose not to do it. Might a complication never occur? Probably not. But I don't choose to inject I don't inject noses or glabellas because I don't want to risk any blindness with my patients. Might it ever happen? No, might never. You've done noses forever, and
I used to inject
nobody's blind
noses.
yet. So
knock on wood, thanks, Lori.
Sorry, but I mean but you've done them forever, and you know anatomy, and you have your method of doing it. But when you see in research that there's really high risk areas for blindness or for issues, we kind of sometimes are more careful in those areas or don't do them. Right. Temples are a higher risk. I do temples, you do temples. Those are a higher risk. So I'm like, there is no safe area in the face. There's safer and less safe. I think there's no safe area.
There is no safe area.
You just have to be careful.
Yeah,
everywhere.
I think you just have to be careful or understand what you're doing, why you're doing it, understand the adverse events that could possibly happen, and why the benefits. What are you doing it for? And when you explain it to your patients, then it's up to them to say, yep, you know what, those benefits versus that negative outweighs it, then let's go ahead and do it. Same thing as a practitioner, figuring out what is good, what is bad. We can go to the next one. Recognizing occlusion.
So
as we go along talking about this.
Yeah, this was a young lady that was injected with hyaluronic acid filler, and the provider did not recognize the symptoms. And she was sent home with it looking like what you see on the right-hand side, and the next morning it looked like what you see on the left-hand side.
Nice.
So they did not recognize that, which is too bad. So by the third day, she was able to get some hyaluronidase and get some of this stuff dissolved. But it's really important that like this is nasolabial fold. Do we think this is a safe area? We used to, right?
Yep. My one and only real occlusion that I can really talk about was actually nasolabial.
Yeah.
And that only happened within the last 3 years.
Right. And how many you've been injecting for
17
years. So, you know, and we don't do as many nasolabial folds now as we used to.
No, we don't.
But we used to do them all the time.
Oh my God.
And we didn't get occlusions. I mean, we used to do them all the time. So now we know, we're like, that artery's 2 to 5 millimeters under here.
Yeah.
How did we miss it? How did we miss it? I don't know. So, yeah. So
there is definitely something, I honestly think, to injecting at an angle. I mean, I will go back and look at that occlusion, and I'll tell you, I injected that nasolabial fold just in a little bit more of a perpendicular aspect of it, just because it was the last 0.05 in there. And it's like, you know what? She's complaining more. Just drop it in there. Fine. We'll just do it, because she's just one of those patients. And then, boop. And nothing happened. There was no blanching, nothing that you could see. And literally 12 hours later progressed to something like what you saw in that picture over there. And so ultimately you can see even 0.05, and it was a Restylane Refine actually that I injected into the patient, because we were using it on her lips and stuff like that, and she didn't want to waste it.
And okay, so tell our audience, you sent her home.
Yeah.
Why?
Because there was nothing.
Nothing.
Zero. I mean, I have a picture of her. She's one of those patients that went into the car, took selfies of herself. So she actually had an after picture of herself. And you literally, if you blow it up, you can maybe see a tiny little blanched area, but
which could have been the needle poke.
But it could have been the needle poke. I really don't know. It's like, now that you know that she had an occlusion, now you can go back and like, oh, maybe it was that area. But literally, there was no blanching whatsoever that happened, and it literally was the tiniest amount. But looking back, to me, it was probably because I did a quick perpendicular injection just to inject the rest of it in there. But literally, it was something that progressed for her over the next 10 to 12 hours. And literally, by the next morning, she DM'd me, and I was like, ooh, that doesn't look good. Come on in. Let me take a look.
Yeah. So it was hours later.
And remember, it's not an emergency. Don't freak out. Have a plan. Have an understanding. Let's check it out. Brought her in. Checked it out. Checked for capillary refill. Oh, it's a little bit slow. You definitely see progressing up through the nose area. Got my Highline X out. Added some lidocaine. Injected throughout the whole area. Did that. Put some warm compresses. Massaged it. Waited. Maybe checked back half an hour later. Checked and see. Oh, most of it resolved. There's a few little areas. Put another little bit of Highline X in, and then let her sit for a little bit longer. Completely fine with that. Sent her home, and then you just follow her up the next day. And by that time, most of it had pretty much all resolved. And so you can progressively, work through this. I mean, it's not something that you guys have to be super scared about. I hope that unfortunately, a lot of you guys that are starting in the industry now are getting much more scared, because all the conversations are about vascular occlusions. And my biggest thing is, don't obsess about them. It does happen. You just need to know that it can happen, but don't be that person. My analogy is like, don't be that person scared of getting into an accident. You're driving and you're watching out for accidents. You're not really paying attention to what you're trying to do. You're going to be that one that gets into an accident.
Yeah, it's not as, we don't want to scare you guys. An occlusion is not going to happen as often as you think it is. And just be safe and aspirate. Okay, the other dangerous thing I wanted to talk about is the consensus paper telling you not to aspirate. All right? Aspirate. There is no reason not to. Think of it as wearing a seatbelt. Right?
True.
Don't wear it. You might not get in an accident. What? So please aspirate, and aspirate effectively. We'll probably do a webinar on effective aspiration, because I see so much ineffective aspiration out there. So that's going to be a whole nother subject that we will probably do, because I feel so strongly about that. But yes, aspirate. That's another dangerous thing out there, is that consensus paper telling you not to. So you can tell whoever you want to on there that I'm not happy with them. But yeah, that's another irresponsible thing I think that's out there. So just between you, me, and the wall, and all of you guys watching. Yeah, I'm going to get messages about that one. So we want to kind of go on to the Highline pen. Yeah. This Highline pen. This pen is a device that has like a charge to it, like they pump it, and it's, or the CO2 cartridge, and they put hyaluronic acid in it, and the cartridge shoots hyaluronic acid through the epidermis and dermis and into the lip.
Does it still hurt? I don't know.
Yeah.
It should hurt, right?
My patients have said it hurts like heck. Like they said it hurt super, super bad, because it's usually, generally, these people that are doing this are unlicensed because they're not licensed to inject, and they will buy the product as counterfeit product. They can't buy legitimate product.
True.
So it's going to be usually estheticians or somebody, nobody licensed is going to do this. But patients go to these people because they don't know. They see other people doing. One of my patients is married to a doctor, and she went and did it. So people are going to do this because they just think a friend does it and they like it or whatever. They both want to try it together, and it's kind of fun. So let's just go get a Hyaluronic pen. But there, if you look at that left-hand picture, that's an occlusion from a Hyaluronic pen. This is so much. If you look at the needle on the right, you have a very specific dose of hyaluronic acid you're putting in there. The Hyaluronic pen just shoots it everywhere. And there's a higher incidence of vascular occlusion with this Hyaluronic pen because it's like a shotgun, and it shoots it into the tissue. So it could be extremely, extremely dangerous. So educate your patients.
A lot of lumps and bumps.
A lot of lumps and bumps and problems. And the problem is they can come to us to try to dissolve this, but we don't know what the product is. It might be silicone.
Charge them up the wazoo.
We don't know what the product is. So, and the other thing is, when my patients have used this, I know they have counterfeit product in there. So do I want to put legitimate product on top of it? And if they have a reaction of some type, what was it? What was in there? So I don't touch them. I let somebody else do them. I don't touch them.
It's true.
So just beware of that. Yeah, it's kind of scary.
Even, I mean, to go off of even that, I mean, we're here in Southern California. We see a lot of patients who go down to Mexico who get stuff done. Now, granted, there were some great places down there, great plastic surgeons, great work. However, as well, there are always going to be a lot more shadier people in a country that may not have strong regulation as we do here in the U.S. And so I get a lot of patients who actually have gone down there, and I end up trying to dissolve out their lips, and I tell them, sorry, I don't know what it is. I've given it 2 shots. You've paid a lot to dissolve your lips, and you can see it's still there. So, definitely helping your patients, advocating for making sure that we're injecting safely and using FDA-approved products here in the U.S. is going to help out. I mean, we just literally over Memorial Weekend, we had a patient reach out to her more and me, and they'd gotten injected here, but for some reason they decided to go down to Mexico. They got injected with what they said was Radius, and literally developed a vascular occlusion. Literally tried to manage it or whatever little thing that they did there, and they sent them on their way, and the poor patient now has a vascular occlusion. Blisters and all of that stuff going on. And we'll see how she'll respond, and hopefully she responds to some of the treatments that we have here, because ultimately we don't know if it really was Radius that was injected, and then we don't know, where they really injected. They probably got her a vascular occlusion, and so hopefully that they can, somebody will manage her properly. Yeah. So
it can be scary. We get messaged with I get a lot of messages. I got like 5 this weekend on adverse events, and people, they can't get a hold of their providers on the weekend. Which, if you're a provider, please give your patients a contact number, some way they can contact you over the weekend. Because if there's a problem, say on a Friday, and you inject somebody, and something doesn't show up till Saturday, and you're closed Saturday, Sunday. Then it could be 3 days before you get to them, and that's too late. Yep. They've got vesicles by then. So just make sure they have a way of contacting you if you're a provider.
Yep.
That's really important.
Exactly.
Yeah. So that's our Hyaluronic pen. So next thing we want to go to is PMMA, which is polymethyl methacrylate in silicone. This is a woman I know, and she was injected with PMMA, which is polymethyl methacrylate, which is powdered up plastic. It's like Lucite. It's like those hooker heels.
Bellafield.
The hooker shoes.
Bellafield.
Bellafield. So at the time it was Artifil and silicone. And what happens here is when you get a permanent product like these and they're injected, the patient runs the risk of having an inflammatory reaction to these products.
Yep.
If there is an inflammatory reaction, you can't stop it because you can't get the products out of the tissue. So she had these in her facial area, and this what you're seeing is a process of months of inflammatory reactions occurring and not being able to stave off the process. And she was injected with all kinds of products, all kinds of things, collagenase and all kinds of things to kind of stop this from happening. And she ended up losing her entire forehead, and they had to flap her shoulder onto her forehead. So now she's got her shoulder flapped onto her forehead. But the point of this is watch out for permanent products. Today, I had a patient come into my clinic who was a consult, and she said that she was seeing lumps in her upper lip. And I said, oh, okay, you know what? And she turned her upper lip up, and she literally looked like she had a white marble in her upper lip, a small marble. And I'm like, what? And then I put gloves on and I felt her upper lip, and I could feel
all the bumps,
like hard mini marbles all in her, just hard. So she had been injected with something a few years ago in Jordan. Don't know what it was. The guy said it would help her lips, keep her nice lips, nice and fluffy. Now as she's getting older, she said they're growing. I said, no, they're not growing. What's happening is you're losing your fat and your tissue is thinning and these lumps are starting to show through and they have to be surgically removed. But there must have been 30 or 40 of them all in her upper lip, causing her to look like the Marge Simpson lip. So it's scary. Permanent stuff can be scary. Thank goodness she doesn't have an inflammatory reaction to it. It's just sitting there. But as she ages, we age and these permanent fillers stay.
Yeah, and they
don't change.
This is one of the things even having even next time even doing a talk about this is we're injecting people based off of their current aged process. What happens 10, 15, 20 years from now as their skin thins, as the muscle thins out? Are we going to need to dissolve it to re-inject them in a different way? Because now that we're starting to see some of these fillers are lasting 8 years, 12 years.
Yeah.
This is where, sometimes like under eyes is probably one of the more apparent areas where you inject it properly, it looks great. And then after a couple of years, 4, 5, 6 years, you're starting to see maybe a little tindling effect, starting to see that it bulges out a little bit more. And they swear they have not gotten injected again. It's like, well, it shouldn't have migrated at that time. And now you have to think, now the aging process of the face is happening. The skin's getting thinner, the muscle's getting thinner, things are starting to change. And so that product that may have been placed 5 years ago, 7 years ago, actually may need to get dissolved before you go back in and re-inject them at their current stage. So, this is something for the evolution of this field that I feel is going to be important to talk about in the future, is really the changing of the face. And we're having girls come in now at 20 years old. What's going to happen when they're 40, 50 years old and they're changing? Because I see this with my patients who've gotten like cheek implants or chin implants. As the bone changes, I've seen one that literally the cheek implant slid. And, really just like, okay, well, what do we do now? And it's like, well, the cheek implant was supposed to stay there forever. Well, we forget bone resorbs and readjusts and grows in a different pattern as we start to age. Fat disappears. Skin disappears and gets thinner. And so there is something you guys need to start thinking about as we're doing all of this, is don't make it the end all as I didn't inject that, that's not my problem, blah, blah, blah. It's like, you know what, as you're injecting, we may need to dissolve and re-inject and dissolve and re-inject as we go forward. And something to think about for us in this field.
I agree. Some of these fillers you see, I think we as providers are becoming very acutely aware of how long these last.
Yeah.
I had a girl come in to me from another state, and she drove in to have her do her lips. And she said she had her lips done 1.5 years ago with Kiss. And I looked at her lips and I'm like, those are stinking perfect. They look great. And they look like you just had them injected like last week. They were like bigger, augmented, but not big. They were just, you didn't want me bigger. But you could tell they were injected, and they were beautiful. And I said, it was a year and a half ago. And she's like, yeah, it was a year and a half ago. They're probably gone. I'm like, no, it's all there. It's all there. So I didn't inject them. I'm like, I'm so sorry, but they look great. I'm not touching them. And she, not that she wanted it bigger, she just thought it was gone. So people's perceptions of themselves changes. And Sabrina Fabi wrote a good paper on this called Perception Drift. People's perceptions of themselves kind of changes over time after they get fillers. They forget what they looked like, but they forget what they look like. They kind of forget what they look like, and what they're augmented is their new normal. And then their next augmented is their new normal. So it's important for us as providers to kind of recenter them and bring them back to like, look, it's okay. Don't do anything now. Come back in 6 months. Right. And it's okay for us to say no sometimes. But yeah, these things, my point is these things last longer than what we think. They really do.
Right. So why do we need longer, even these permanent type of things like PMMA and silicone? You guys have to realize permanency is not anything that we should be dealing with in our field. Even in plastic surgery, facelifts don't last forever. They literally age in the next 5 to 7 years, and that's why they need to redo it again, because you can't stop the aging process. So why are you placing something that's going to be permanent in a thing that's going to be constantly changing? Makes no sense to me. So be a little bit careful with things that say, oh, it's going to be there forever. No such thing as forever. Forever means that it's going to be there while everything else sags, and that is not going to look good.
You look like Maleficent.
Because you're not gracefully aging. You're literally aging with bad product placed in the wrong place.
Yep. So plasma pen is another one that, or fibroblast or whatever. There's lots of different names for this device, and it's the only thing that makes it a little bit dangerous is it's extremely user dependent.
Yes.
And whoever uses it needs to be really careful and really skilled at doing it, because this device can go too deep if it's left on a little bit too long and take away pigment. And there have been a lot of cases where people have had, once it heals, they're left with white dots all over them because it's been so deep, it's taken away their pigment. Likewise, there's been a lot of cases of hyperpigmentation that doesn't go away very easily. Usually it's like pH, but it doesn't go away very easily from this device. So the plasma pen is one that I generally don't recommend.
It does have good results,
but it can tighten in the right hands. I think somebody's got to be very trained.
In the right hands, you can do it. It's kind of like a laser. You can have bad settings, and you can go too aggressive. But this one is definitely one that should be done on the lighter side and really talk to the patients. Not just one treatment, maybe a couple treatments. But making sure that you're getting a good plasma pen, that it's not a cheapy little plasma pen. There are ones that are starting to get FDA approvals. And so you want to try and get those into those pens. But, I have seen some great results on patients. I mean, no doubt that this can do some nice superficial tightening on patients, and it can look beautiful. You just have to make sure that, as Lori says, that you're choosing a good practitioner, that you as a practitioner are understanding how to use it properly and not to overly treat your patients that you cause scarring. Yeah.
And if you want something that's less user dependent, CO2 does pretty much the same thing.
Yep.
It's very close. So you can adjust that, and it's
CO2,
very
microneedling RF probably.
Yeah, microneedling RF is very you set it, and it's very consistent as far as the depth, the level, the heat, very consistent. This can be extremely inconsistent. So as depending on the length of time that is held on the skin, that denotes the amount of heat that's dissipated in there. So just FYI, just kind of watch out for that, and make sure if you have that done or you are doing that, make sure you're extremely trained and very consistent with it. Otherwise, there are going to be some decent problems with it. Yeah.
For sure. What else?
Aspiration. So we kind of brought my thing. We kind of brought this up. This is actually my chin, my needle. I think I've hit like 3 arteries in the chin now that we're doing a lot more chins. It's crazy. There's a lot of arteries in the bottom of the chin here. So that's a 25 gauge 1 inch, and it was a needle I had already used. I put it back, I deprimed it, and which means you pull back until it burps, until the product's out of the needle, and I put it back into the chin to inject, and within 2 seconds I got blood flow back. And this is a 1 inch needle that I deprimed with lift. So, and I'm going to go through all of that when I do my aspiration webinar. Hopefully we'll do that soon. But if you have a clear needle, you can get it back much more quickly. And like I was kind of ripping on this consensus paper because they mentioned to not aspirate. They recommended it's not 100% sure, so don't aspirate. And my thought is, who knows how many hundreds of thousands of occlusions have been averted because of a positive aspiration.
True.
You know, so, True. You know, we don't do statistics on that, but I would like to. Send in all your positive aspirations. But, you know, I've had a few positive aspirations, and we, if anything, we're relieved when we get that, because we're like, thank God I didn't inject. Mm-hmm. You know, thank True. Goodness I can take it out and go somewhere else, and I'm golden.
Yeah. I think aspiration is very important. I think that it's not something to take lightly. As you use an analogy, it's like wearing a seatbelt. I mean, ultimately, most of us wear seatbelts for that, just in case you get in an accident and you don't go through the windshield and fly out into the middle of nowhere land. You know, at least it's there that you are, that is that secondary safety measure. So I don't think there's anything wrong with aspirating.
I don't either. Let's write our own paper. So that's it that we have right now for our discussion. But we have a few. We have a few things we want to kind of talk to you about. And
we have a new contest.
That is a new contest.
Yay!
So we have a new contest. We love contests around here at AI.
Giveaways.
Yeah.
To give away things.
So the Aesthetic Show is a great meeting. It's one of my favorite things to go to.
We'll be there.
We'll
have a booth, so come by and say hi.
Aesthetic Immersion. Yeah, Aesthetic Immersion is going to have a booth. So you enter, you're going to win two tickets to the Aesthetic Show. And you have to follow us at the Aesthetic Immersion and at the Aesthetic Show. Follow both on Instagram. Tag a friend you want to take with you. And we will announce the winners next month on July 6th at our next AI Live.
Yeah, right before the Aesthetic Show. So the Aesthetic Show is July 8th through the 11th, I believe. I think Lori and I will be...
8th to the 11th. We're going to be there.
We're going to be there. We're going to be talking and things like that. So, yeah, definitely come by and say hi if you guys are at the Aesthetic Show. But we have our winner from May.
Yes, we do.
And that is at Beauty by Nurse Britt. You just won 2 tickets to the Aesthetic Show. So yay, congratulations.
Yay.
And we will see you. Oh, we have a couple of questions before we get going.
Oh, thanks you guys for sending in questions. We love this. So anyway, Beauty by Nurse Britt will be contacting you.
Yes.
So congratulations. And you'll love the Aesthetic Show. I hope you go. It's awesome.
I know. Okay, questions. You guys have been in the industry for a long time. Allergan filler comes in 1 cc's. They're a patient who needs only half cc's of vials. Are they forced to buy the whole vial in some states? How come practitioners never address this issue to manufacturers?
Allergan does. They do have some of their products that come in half cc.
Restylane does have half cc. Just regular Restylane does come in half cc's. You know, I know patients are always about trying to get away with the least amount. You know, the problem is, remember, you have to package it a certain way. The packaging is the most expensive part. Adding another half a cc isn't that much more in a sense. And honestly, the price point with regards to it really, really is not going to be super advantageous to the patient anyways, because it's going to be more than half the price of a normal 1 cc. Yeah. So ultimately, it's kind of like you go to, you go to any of the fast food place, you buy a medium versus a large. It literally is that much more. You're like, why not just buy the large?
Well, see, that's how the theaters get you. That's a marketing thing.
It is.
The small is $5.
That's honestly what you should be.
The medium 7 and the large is 8. And you're like, well, if the large is only 8 and the medium 7, I'll get an 8. I'll get a large, right? And who's going to pay $8 for popcorn? Okay, anyways.
But I mean, at the end of the day, that should be the same with your fillers. I don't think, even if you're using half a syringe, you can take the other half a syringe.
Do you ever use just a half syringe?
I personally don't.
I don't either.
I honestly don't think that you should be just half syringe. I mean, if you're just doing half in the lips, fine. You're just going to give them that little gloss over. But find another place. You know, most people need a mid-cheek or a little nasolabial fold.
You
I
can
don't
find
think
somewhere to
there's
put it.
anywhere that you can't put it. And it's actually a nice way. I love doing it that way because I'll always like doing lips because I always have a tiny little bit. And I'll say, you know what? Let's not waste this. Let's add a tiny little bit underneath your mid-cheek area. And I'll put a tiny little bit there and I'll give them the mirror and say, see, if we actually had more to work in here, this is what it could look like even better. And they go, oh my God, that did make a change. So it's something that you can get your patients to try out different areas by being able to, do that. So I personally would never sell a half a syringe. I would just do a full syringe and just tell my patients that it's all full syringes. By FDA standards, yes, you cannot save, or at least here in California, you can't save it. If they find out, you will get a $10,000 fine per each event. So don't save your syringes.
You can't. That's a legal mess. Don't save syringes.
Don't save syringes. Just use it
I see so many clinics I go to and teach save syringes, and number one, you can't guarantee sterility. You can't guarantee the quality of the product once it's been opened, and how are you going to store it? And then not even only that, but what if the patient comes in and gets an infection or cellulitis or a biofilm, and you get sued because you used an old product and now you don't have a leg to stand on legally. Right. Not one leg. You will lay down and open up your pocketbook for that, and it's not worth it. I'll throw away the syringe. I throw the syringe away. If there's nowhere I can put it, I'll chuck the last 3/10.
There's always somewhere you can find to inject it. We're all aging. Remember, every year of life, this whole face ages, and you're losing 3 to 5 cc's of volume. So if you're not adding 3 to 5 cc's, you're not actually gracefully aging. You're aging.
So our next question was somebody asking about IV nitro for vasodilatation.
For occlusive?
I would probably drop out their blood pressure.
And you have to realize, you're blocking it right there. You vasodilate. Guess what? It's going to go downstream. It's just going to go downstream, and you're just going to block downstream. So
we want to break it up.
No, I think in surgery, what they're doing is they're opening it up so they can put a stent. Perfect. Yeah. But with an occlusion, you're blocking it here because that's where that is narrowing out that you're getting a blockage. You open it up, it's just going to flow more downstream to block that more.
So the Highline X goes through the vessel. Hyaluronic goes through the vessel wall. So when you high dose it, it's going to hopefully hydrolyze it, and it's going to break up. And you're hoping it doesn't break into pieces and go way downstream and then cause an occlusion further downstream. So always watch for that. But that's a good question. That's a really good. Your mind's thinking. That's good. Yeah.
What do we think about threads and how they look at patient ages 5 years or more? Well, remember, threads are biodegradable. They're stimulating collagen, so like a collagen stimulator. The threads do dissolve. These are not non-dissolvable ones. So the non-dissolvable ones were used here in the U.S. probably about 8 or 10 years ago, and they had a lot of issues with that. So now all the threads that most of us are using are going to be dissolvable. So they dissolve within 9 to 12 months and they're gone. So it's not something that is a permanency. Okay. All they are doing while they're there is stimulating collagen. So like your radius, like your Sculptra or hyperdilated radius and Sculptra, you're stimulating collagen into the area. So no problems with doing threads.
No, it's fine. We recommend that they redo it at least once a year just to keep up with the facial aging process and to grow new collagen. I always say when threads go away, collagen plays. Yep. So it's not a problem at all with aging. It's going to help them with the more collagen growth. So that's a good thing. That's a good question too. Botox Lip Flip. Do you do much lip flip?
Nope. I hate Botox lip flips, honestly. If I'm doing lips, maybe you can add it in there. I'll do upper lips for a lot of righted just to stop them from doing that motion. But for my young girls who are doing Botox lip flips, I mean, spending $75, I charge $75 to $100. I don't know about you guys, but my time is precious. My patients are waiting already for 4 weeks to see me. I don't have time to bring them in for a $20 lip flip. I mean, that's useless to me. Like, why would you do that in your practice to do it? I know it's a thought. It's cool. Yeah, it softens it up. But the amounts that you're putting in there are so tiny, because if you put a full dosage that's going to last them 3 months, you're going to have no movement in the lip.
They won't be able to talk.
They won't be able to talk. Yeah. So, remember, Botox is one of those things. It's literally dosage equals duration. Yeah. The less you put in, the less duration it is. And so I'm not a big fan of Botox lip flips. And if you're not using something like a Xeomin, you're constantly creating an antigen in
Possibly.
this patient that they could
Yeah.
potentially in the future, when they really need it for the actual wrinkles, they're going to have some big issues because now they have these neutralizing antibodies that are formed, because you're starting to see a lot more people with these neutralizing antibodies, and it has to do with not necessarily, definitely large dosages, but also these small little things. You're constantly just attacking the immune system. Here, a little bit more, a little bit more, a little bit more. So unless you're doing Xeomin with lip flips, I think that's probably much better, much safer for those small areas where you're doing constantly. But Botox, Dysport, Jeuveau, all of those, you just got to be careful because there are the potential of neutralizing antibodies.
So we have our last question, and we're going to have to go. Bellafield. Do you ever inject Bellafield? It's a huge part of your practice. Should you back off and push other options? I don't know. Do you like playing with fire?
No. I looked into Bellafield, and we talked about PMMA.
Yeah.
It's plastic. And it does not dissolve out of the system. Hyperdilate radius, Sculptra, all of those do dissolve out of the system. Whether it is 1 year, 2 years, 3 years out, it is out of the system. Bellafield does not go out of the system.
So I know a lot of practices use a lot of it. Scares the pants off of me.
You had a patient, a doctor who comes in.
I have a doctor who comes into me, and she has these nodules in her nasolabial folds, in her marionette lines, and they come and go. They get inflamed. They go away, and she cannot figure out. And she's a physician. She can't figure out what triggers them. She's not ill. They enlarge. She gets grapes in here, and the only way you can get that stuff out is to cut it out. So if you have a patient that's an outlier who does have an inflammatory response, like my patient, my friend who's had the forehead that you saw, gosh, you just don't want that to happen. And if I can pick a product where I know that's not going to happen, I'm going to pick that product. I don't want that to happen to one of my patients. So I always want to err on that side of safety or on caution with my patients.
Yep.
So that's why I don't use the non-dissolvables or things like that. I just, we want to be super, super careful. So it's going to be your practice decision, your decision, but just kind of know what can happen.
Yep.
And
it's not to say that you can't use it.
Yeah.
You just have to understand, if there is a ramification, can you deal with it? If you can deal with it, perfectly fine. If you want to sleep at night and not have to deal with it, then don't use it. Like, she won't do a nose, I'll do a nose.
Yeah.
So I don't think there's anything wrong with the product itself. It's just, you have to understand, PMMA does not dissolve out of the system. It stays there forever. So, if they get an issue with the PMMA, and it may not be everybody, it may be that 1 out of that 10,000 patients you treat. But if that reaction is severe enough, are you going to be okay with it? I think it just comes down to your own guts and cojones on what you are comfortable with at the end of the day. I don't think there's a right or wrong way on that aspect of it. But that's our opinion.
We hope you enjoyed today. It went fast, us just chit-chatting, but hopefully we kind of just, it was interesting to you guys. This stuff is interesting to us, and we love to chit-chat about this kind of stuff. So,
all right. Well, if you have any more questions, or you want us to talk about certain topics, please email us at learn@theaestheticimmersion.com. So that we have different topics to talk about in the future.
You can DM us on IG too.
Yeah.
So you can DM us on our IG at The Aesthetic Immersion and ask us questions, and we'll be here next month.
Next month, July 6th.
6:30.
At 6:30. All right.
All right, guys. Thanks so much for joining.
Thank you. We'll see you next time.
Bye-bye.
Bye.